Hi, thanks for joining me today. I'm going to ask you a question. How can you differentiate between a heart attack and a heartburn? Thank you for joining Amedi Without Jargons. Now, the reason why I mentioned that because one of them is very serious and dangerous and deadly, and the other one, you can live with and manage with. So I had a friend, as a pharmacist over 20 years experience, a friend rang me panicking of this chest pain, wondering, is it something sinister? Is it a heart attack or is it just heartburn? So two things I'm going to do. Number one, I'm going to look at, I'm sure you guys know this already, but I'll go through it once again, the symptoms of heart attack and heartburn. And I'm also, most importantly, look at how can you even know that what is going on could be a heart attack. You actually have the answer, so listen to the end. But before I go into the symptoms, I heard there was this young woman, this is a true life story, who was, she's in her early 20s. She was suffering, having a heart attack, and she stumbled out from where she was in a pub and feeling choking and breathless. And initially people thought, she was drunk. And then, but it carried on. Anyway, she ended up in the hospital where they found out that she was actually having a heart attack. They did some work, did some job, discharged her, but it carried on. It didn't stop. In a few weeks' time, she had another heart attack. Eventually, they found out that she needed a new heart. She had a heart transplant. She lived. But that's to tell you that sometimes what people think is not what it is. The assumptions is not what it is, but you have a way, like I said today, you have a way of finding out whether what you're going, that chest pain, is it possible a heart attack or is it just a heartburn? So what are the symptoms of heart attack? We know chest pain and that feeling of pressure or heaviness or tightness or squeezing pain in the heart. We know about feeling of lightheadedness and sweaty. We know about shortness of breath. We know about feeling sick or even being sick. We know that feeling of panic and anxiety. And sometimes people are coughing or wheezing. Those are common symptoms of heart attack. And what are the common symptoms of heartburn? Now, heartburn is something people get when they've had a fatty food or spicy food, or they have smoked, or they even eating some chocolate. Imagine that can trigger a heartburn. But the symptoms are a bit similar because again there's a chest pain. There's also an unpleasant taste in the mouth with heartburn. And there's a what we call reflux, acid from the tummy coming up. And that's why you have the chest pain when you have heartburn. And also there's an unpleasant taste in the mouth and you feel that you're going to be sick. So really you can see that there's quite a similarity between heart attack and heartburn. But there's a way of identifying whether what you are going through could be a heart attack. The first way of identifying it is through history. History, two types of histories. One is your personal history and the other one is your familiar history. So personal history is this. If you are the type that have smoked a lot, or you have drank a lot, or you don't even know what your blood pressure is. It's the three things I've always advocated people should know is that people walk around, they don't even know what their blood pressure is. They don't know whether they are diabetic. They don't know whether their cholesterol level, what it is. They are eating all the wrong food. They are drinking a lot of alcohol. Do you even know how much alcohol you're meant to drink in a week? Watch my short video on how much alcohol you need to drink. Do you even know what your regular blood pressure is? Or have you ever checked it? So the thing is that if you haven't really checked your blood pressure in years, you don't know what your blood pressure reading is, You don't even know whether your cholesterol is high. You don't even know whether you're diabetic. Then, if you're having a chest pain, I would say ring, and you're having symptoms of heart attack, I would say ring may have an urgent medical attention, because that could be heart attack. And also, the point I want to make is, gone are the days where people say, "Oh, I'm not old." No, younger people are having heart attack. In fact, statistically, it's shocking to know that people under 40 are having heart attack, and most of them are not making it. In fact, the statistics says that 6 out of 10 people under 40 with heart attack have a very bad outcome. Maybe because they never thought it was going to be a heart attack. So please, it's no more a matter of whether you're in your 20s or your 30s or your 40s. Anybody can have a heart attack. So if you're feeling that kind of pressure in your chest, shortness of breath, and you're feeling tired or squeezing in your heart, and you haven't really made any effort to check your blood pressure or your cholesterol or your diabetes level, my advice is have a medical urgent attention. The other part of history I wanted to mention is familial history. So this, very well whether your parents or your sibling or your grandparent had a history of heart condition. That will also be an indication that this could be a heart attack. So if you had somebody in your family who has had a heart attack or stroke or any kind of cardiovascular problem, then maybe that what you're suffering could be a heart attack. The other second point I want to mention is genetics. You see, the thing is that you might be living well, having a healthy life, no family history. Nobody in your household has had issue or heart condition. You're very fit. You even run marathon. This is why some people who think they cannot have it, they have it. It's called genetics. Because genetically, you might be predisposed to a heart attack. So if you're having symptoms of heart attack, it doesn't matter. Your body more than anybody knows it. You have that instinct that this is not normal, that this chest pain is different, that this feeling of lightheadedness is different, that feeling of dizziness, it has nothing to do with what you've eaten or what you've drank. It has nothing to do with the fact you haven't had a good night's sleep. It's not asthma. It's not COPD. So all those little things, especially when you start feeling pain and tightness in your chest that is not easy enough, please ring a medical emergency immediately, because that could be a heart attack. Thank you for watching, and see you next time.